we can really benefit from in the realms of human ophthalmology. I would like to introduce to you guys Dr. Ivo Ferreira, and he's a graduate from University of the Republic of Uruguay in 2008, a medical school, and he's a postgraduate in cataract surgery, anterior segment surgery, and clinical research from University National Autonomous of Mexico. He is also an attending physician at the Institution Conde de Valenciana in Mexico. I'm practicing my Spanish here, which is fun. And he's ophthalmic surgeon at Sanatorio Durango, a hospital in Mexico City, the founder and CEO of the Ophthalmo University, OftalmoCast, and Phaco Mentors, which are all training platforms. Ivo is a world leader in ophthalmic training via simulation, which, like he said, I've met in many meetings, ACA, SCRS, AAO, even at the ESCRS in Europe. So it's a great pleasure to have him here. He's actually in Brazil now also doing this, helping people learn with simulation. So it's a great pleasure having you here, Ivo.
No, the pleasure is completely mine, and also to be with this amazing group. Henry, you are such an amazing leader in ophthalmic surgery. I also want to introduce Dr. Oliver Garcia, which is also a great cataract surgeon, a cornea surgeon, okay, and also a mentor in the Ophthalmo University campus. He has a lot of experience with simulation, but also surgery, and he has amazing videos for you for corneal surgery. Basically, what we're going to do today is for you to learn one thing. All you can learn in a simulated environment. Now, our reality as a surgeon who is evolving day by day is changed completely. And I can assure you that you can learn so much in a simulated environment that it's not easy to understand or realize. We're gonna make that point today. You're gonna see Beatriz also, who is an amazing surgeon with us, also at the campus. She's in an amazing moment of her career because she is finishing her fellowship, but also had the possibility, but while doing the fellowship, also using a lot of simulations. So she's going to be someone who can teach us a lot on what do you learn in the operating room and what you can learn in a simulated environment. So we're going to have a great time. I'm going to start strong and fast. I'm going to show a couple of slides for you, okay? And then we're going to start using the simulator. That is the most important thing today. So the first thing, of course, I'm going to share my screen very fast here. Give me 1 second. There you go. I want to reproduce here. So the first thing is to welcome you. We are a community of surgeons. You are part of that community, and I want you to feel part of it. We are obsessed with one thing, as how much you can improve as a surgeon. And we want you to understand that your journey on becoming a surgeon is our journey too. In that journey, we strongly believe that you need to become first a microsurgeon, then to be ready for the operating room. Then we need to raise the question when you're competent or not, and why not if you want to become a master of cataract surgery and how much you can learn in a simulated environment. First slide that we show everybody, and I mean everybody who puts a foot in that campus, and it's this guy. Probably everybody knows this guy, right? And when I ask people, I would like to ask in the chat, but this is going to be fast. But if somebody wants to answer, more than happy to listen to them. But I ask what this image shows you, what it makes you feel. Many people say, winning. Many people say resilience. Many people say training. Many people say excellence. And okay, so people are I love this because this needs to be interactive. Camilo is saying persistency, and Jose is saying the best on what he does. I strongly agree with those. For me, especially makes me or moves me something about failure. I think he understood failure completely different of what we do. Talita is saying practice makes perfect. I like that, but I'm going to add perfect practice makes perfect. And then we're going to talk about a little bit about deliberate practice. Somebody says practice again, hard work. I strongly agree. But then I ask this question. I ask people, if you had Michael Jordan sitting next to you and you ask him what was his best skill, just that simple question. Hey, Michael, which is your best skill? What do you guys think he will answer? And again, many people say hard work. Many people say practice. Many people say talent. Why not? And many people say, let's say, oh, there another Valeria is saying discipline. Jose is saying resilience, dedication. Oof, many answers. I love that. Self-motivation. How important is to have self-motivation when you want to become a surgeon? Oh, I like that word. Whitney is saying consistency. Oh, I like that word a lot. And we're going to talk about it. But guess what? None of them is right. And guess what? I didn't get it right the first time I saw this. And I want you to take some minutes to read exactly Michael Jordan's words. He said, my best skill was that I was coachable and I was aggressive to learn. This is so powerful, guys. Think about it. The best, the number one in his area is saying that he was coachable and he wanted to learn aggressively. That's so powerful. And that's exactly what I want you today. I want you to be coachable. I want you to see Oliver and Beatriz doing so many different skills today with that machine and understand the power of deliberate practice, of objective feedback, and the capability to have repetibility in what you're training to. I want to strongly invite you to follow FACO Mentors in all social media, especially LinkedIn, which is in English, and you're going to see so much resources. We also have a FACO Mentors community, and we're going to soon have a community for veterinarian ophthalmologists, because what you guys are, it's amazing. And I'm going to say this right now, since the beginning. Henry, and all of you who are doing cataract surgery, you are better than we are. You guys are the best surgeons out there because you face so many different situations, right? So many different eyes, so many different species. You guys need to have an adaptability that it's twice as much as we have. So we strongly want to be part of this community. For those who have a couple of minutes, you can enter menti.com and write that code, or you can grab your cell phone and go to that QR code. And I want you to answer 3 simple questions. It's going to be very easy, guys. So take your time, answer those questions, because this is going to be interactive. Okay, so it's menti.com. You enter that code, very easy, it takes you like seconds, or you put that QR in your cell phone camera. And also, we have another great part of this community, which I hope he's asleep now. He helped us so much with this. That is Dr. Lisandro Carnielli from Barcelona. And he is the tech guy behind this. He's an ophthalmologist, don't get me wrong, but he's the technical issue. And look what he did. We are doing a FACO course for you guys, which is going to have so much content. And well, of course, Henry is part of this and many other people around the world. This is a big community. Our only objective is to share knowledge. The only objective is to improve as surgeons. And we want to do everything we can in order to create this community and make it big, okay? For those who are interested, this is the QR code, and we want to build this course with you. You are the expert. You are the guys who know all the differences between human eyes and different races of animals. So this is going to be an open course for you, and I think it's going to grow every time. Couple of important things. I really want you to understand what this guy is jumping to. We really need to understand what does it look like when you are ready, when you're competent, when you're good at what you do. I want you to understand this story about you becoming something you decide you want to be. What it looks like, what is that objective looks like, right? What is looks like when you're going to put in the surgical head and you enter the operating room to do surgery, you and change the quality of life of life being. For that, one concept, completely obsessed with Steve Jobs, and as many people who knows me know, but we need to define the problem. If we want the solution of you becoming a surgeon, we need to define the problem correctly, and then we're going to have the solution. Second thing, we're going to go to the basics. We're going to go to the basics every single time that Oliver and Beatrice touches that machine. We're going to talk about hand biomechanics. We're going to talk about ergonomics. We're going to talk about correct visualization. We're going to talk about how to move in an anterior chamber. Okay, we're going to define what it means to be a microsurgeon. Then we need to be ready for the operating room. And then we need to be competent. And I ask you this question, what it looks like when you're ready to do surgery alone. What it looks like which skills do you think you're going to have or you're going to need? Because there is a lot of knowledge and skills and especially experience, right, that you need in order to be ready. So what it looks like, because we're going to go there right now, okay? Think about it. And here I have a strong story that is my story. When I wanted to be ready, I was mostly focused on being reliable, but I wasn't that focused on managing complex cases or solve complications, or especially when to say no. When do you say no? When do you say this case is not for me? It's too challenging, right? It's too complex. And in that story, this is a story for the. Okay, I'm able to put it down. And this is my story. Now I'm doing cataract surgery and I'm showing what I'm doing in that central camera. You know how long it took for me to become the surgeon that I wanted? And especially in this case, I'm using something that is very important in human beings, that is physiological IOP. I'm doing a special technique. I'm removing a hard cataract. But that took me a long time. And when people see that, they forgot that I needed to travel to another country with 32 years old to do a 2-year fellowship with no salary. And that was tough for me. That was the dream of my life, to become a surgeon. That wasn't easy. I went to an amazing institution with a lot of fellows, with a lot of residents, but I had almost no wet lab or simulation before that. And when you see me here smiling in a day that I had more than 50 cataract cases, I had a really hard time. If I'm honest, it wasn't a nice time. I call it baptism under fire. It was difficult. It was hard. It was frustrating. I felt, many times that I wanted to quit. Oh, yes, I wanted to quit in many days because the stress was too much. So I felt like this. I could do a normal case in 5 minutes, but if I had a complication, I didn't even know the most important principles on how to do an anterior vitrectomy, for example. So was I competent? The answer is no. So my tip for you guys is, this is not about a number. That objective I was talking about is about a moment in when you are reliable, and when you can manage complexity, and when you can manage complications. And guess what? Oliver and Beatrice are right there with a machine that it can simulate exactly that. They can simulate complexity and they can simulate complications. Okay, so right now in 2024, to talk about this way to teach in see one, do one, teach one, that I'm pretty sure that when you see that picture, you understand that it's a pretty old picture. And this was described in 1904. We need to change that. And we can do that now in 2024. We're 120 years away of that. So what I want from you is to remove the C1, teach one, and at least do a C1, simulate one, do one and teach one. And in the Ophthalmo University campus, I think we're in the next level in which we want to understand one, why we do what we do. Then we're going to simulate that one. Then we're going to define competency and we're going to be competent. Then we're going to do one, master one, and then we're going to teach one. We want to understand that in the operating room, the important thing in the operating room is the patient, okay? And in a simulated environment, the most important thing is the student and you. And that's exactly what's going to happen with Beatrice and Oliver there. We want to make you the point that we already know that we learn from mistakes. So guess what? Let's make mistakes and learn in a simulated environment and not in the operating room. And there you're going to see the two things they're going to show you. They're going to show you a virtual simulator, or they're going to show you an artificial eye that is designed to have an operating room environment and also to have. What do we have in the campus? We have a convergence of technology, methodology, and mentorship. If you remove one of these three pieces, everything goes to the floor, okay? So basically, you are part of this simulation revolution. I hope wherever you are, you understand the power of simulation and you can simulate a lot before you get to the operating room. And of course, understand this, that this is going to happen because I'm going to shut up and we're going to start doing, we're going to start discussing. And I hope you can get to, a simulated environment and do a lot so your knowledge retention goes to the roof, as you can see in this meta-analysis, okay? We believe everything is, backwards, and we need to make it right. There is a problem in how we train, okay? So we need to learn in the right way. Simulation has been around and has been demonstrated that since 2012, it's even higher, and it's better to train in a simulated environment than in the traditional clinical environment. There is a lot to learn in phaco. You're gonna see it right now. There's so many items there, but most of all, you can see in that picture where, and is the most important thing that you need to learn. Everything happens exactly in that structure that you see there. Everything, knowledge, movement, memory, decision-making, problem solving, okay? So just to finish, we're gonna do this. We're gonna see a surgeon, and we're gonna artificially divide what a surgeon means in three things. We're gonna say this in the end, okay? And now we're gonna start with Oliver and Beatrice, who are gonna show you how much you can learn in an operating room. Okay, it's a pleasure to have you guys. There's so many people. Yeah, sorry. So, somebody talk. Sorry. Okay, so the last thing is I'm gonna share. Let me share here the results. Let me see. Here you are. Here we are. Okay, guys. So listen to this one. These are the three questions I asked. For those who didn't answer, you can also have the QR there. And this is very good. So we have a lot of people here who are doing cataract surgery. For those who are not doing cataract surgery and would like to start, we'll be more than happy to help you. And there is also people who are doing cataract surgery and want to improve as surgeons. So, keep answering, guys. And there's a lot of people that would like to learn. Then let's go to the next question. And here is another question. So I think the platform didn't show you. So we're gonna leave it here. Maybe I'm gonna pick, probably it's the platform that didn't show this picture. Oh, there you go. So I'm asking people now, which is the most important skill for an ophthalmic surgeon. There is the majority is saying all of the above, but many other people, and this is amazing when you see people answering and changing votes. We're gonna have elections in Mexico in a couple of weeks, so we're gonna see something like this, right, Oliver and Beatriz?
Right.
So okay, very good. The vast majority is saying all of the above. We're gonna talk about this kind of skill, and probably if I show the third question, nobody answered exactly, because I think it's the platform blocks you from so try to do this too. And this is important for those who are not able to perform cataract surgery. I would like for you to answer, which do you think are the barriers? Because many people say, well, you know, resources, or people are not willing to pay for their pets, or, you know, I don't have this or that. So let's see if somebody answers here. It's kind of slow, but we can show this in the end. Okay, you see, the first one I told you, cost. Cost is always present. Interesting. People say practice. There's another one talking about anxiety, fear. I love those guys. Thank you for sharing those. Hesitation, anxiety, you know, cases, expenses, unexpected availability, stress. Think about those things, because then I'm going to ask you, how many times do you think we train in those things? We train on those what we call the mindset skills. Okay, so every time a word appears, is gonna make it bigger. We have so many people tonight that I'm so happy. I want to thank all of you. You know, we strongly want you to be part of a big community around the world. This is gonna stay here. We're gonna keep growing. We're gonna do more cases. So we have so much people that I'm gonna thank you again so much. So now the good thing starts. I'm gonna shut up, and now we're gonna see the good things. So Oliver, thank you for being there in Mexico for us. Beatriz too. Again, Oliver has many interesting things in the simulator. Then he has amazing content also for cornea surgery, which is very important for you. We know that. So I want you to start since the beginning, Oliver. We're gonna do now. We're gonna have a journey. We're gonna start very simple. You talking about ergonomics, hand biomechanics, and how to navigate in the anterior chamber. Then we're gonna go to a more complex thing like phaco chop, which is complex and requires many things. And then we're gonna face a couple of complications. So all the stage for you, my friend, and Beatriz.
So welcome everybody. We are at Mexico City at the campus. First, I want to show you some of the things of the campus. So please come with me. So hello again. We are now at the OR simulation room. We have a real microscope. We have a phaco machine. We have a bionic IOL. And as you can see, we have a 3D screen where you can practice as much as you can. So in this room, we have real material, a 3D print IOL, a 3D print eye, and a real phaco machine. So in this room, we can practice whatever you want. Cornea things, glaucoma, bionic eyes, cataract eyes, also retina, everything we can do in a simulation room with the correct practice, with the correct mentor, okay? Now we are going to go to the simulator to continue the practice.
Now,
So, Betty is going to start talking about a little about ergonomics.
so first we have to settle our pedal, our foot, our chair. Everything should be modifiable. So
Yes, keep describing, Betty. We have a camera that was disconnected, but keep going until it's connected.
okay.
There you go.
So it's also so important that our chair is in perfect position, that we sit right on the chair, not like on the periphery of the chair, right? Be well seated, ergonomics, and also the table. We have to set the table. We have to set the eye. so that our hands are relaxed, our shoulders are relaxed too, our spine column, that it stays in good position. Then we have to set our interpupillar distance. And we have to know how to take our instruments. We have to be able to twist with our fingers like this. I don't know if you can see this. The instrument, and place our 3 fingers with our nails touching.
Almost there. There's a disconnection with the cameras. Try not to move that many times, guys, because the cameras can be disconnected. But I want you to understand the importance of ergonomics, and especially with you, Henri. When you face different, species, you need to do general anesthesia. I think this is very important, right? What do we do in the pre-op? What do we do for you guys that you need general anesthesia? And also you need sometimes to take a lot of time to have the correct ergonomics, to have that eye, which is, well presented to you. That's correct, right? Now you can see, for example, what happens after that ergonomics. And I really like for you to understand about hand biomechanics, how you grab the instruments, then how you interact through the incision, okay? And then how you need to navigate in the anterior chamber. That thing that maybe some people found basic, it's so important for a microsurgeon. Imagine how important it is in this case for you to be able to move instruments with your fingers and the correct way and how to grab an instrument and how to navigate in that anterior chamber, having a centered eye. In veterinary ophthalmology, what we see a lot is that it's not easy actually sometimes to even see the full eye, because with the eyelids and the ergonomics and the blepharospasm, it's not easy to have that. So if you are fighting with the eye, and listen to this one, if you're fighting with the eye and you cannot have a center eye without grabbing it, this is a big problem, okay? And in this case, for example, you are not only navigating, but you are facing different sizes of objects inside the anterior chamber. Look at what she's doing, for example. In this case, what she's doing is she's not behaving correctly, so that eye is moving a lot and it's not centered. That's something extremely harmful if you want to do surgery. For example, she's touching the endothelium, she's touching the anterior capsule, and those are big issues in surgery. Again, ergonomics and hand biomechanics are going to be extremely important when you want to become a microsurgeon. And that's something you need to definitely learn in a simulated environment, okay? That's something very important that in my experience, I can tell you for a fact that I didn't know about that, and I wasn't teach about that until I was like 3 months in training. This is something completely the opposite of what needs to happen. You need to manage this perfectly before you get to the operating room. In that case, she's doing another abstract task, preparing herself to do a capsulorhexis. So this is called an anti-tremor training, in which she needs to move a ball in a circle in order to do it perfectly. Look at that. If she releases the ball, she's gonna have a bad outcome. So every time she does a task, she has an objective feedback that then we're gonna show you on how important it is. So what we were talking about, what? We were talking about having objective feedback for deliberate practice. Deliberate practice is what we call perfect practice. Perfect practice in that loop, and let me show you what I specifically mean by that. In that loop, perfect practice means to have a mentor and to have feedback. So this, guys, is something extremely important that you need to know. Only perfect practice makes perfect. When there is a mentor and where is feedback in the loop, that's when you can learn, when you can isolate the skill, define the base knowledge you have, set a measurable objective, and then practice with focus. Look what they're doing now. It is very important here is that she's doing a capsulorhexis, which is something that when you see in surgery, looks easy, looks fast, but there is so much knowledge involved, right? She needs to have the correct biomechanics in her hands, grab a forceps, through an incision, and then create a capsulorhexis. Henry, I would like some comments from you if you can, because what we have seen in capsulorhexis is very interesting. We have seen, and I really like this phrase, that when you're doing a capsulorhexis sometimes in a pet, is not like a regular senile capsule phaco that we do in human beings. There's also the component of inflammation, and that component of inflammation changes the characteristics of that rhexis that can be very thick, but also very elastic. What do you think?
Yeah, the thickness is definitely like our anterior capsule in dogs is much thicker, and oftentimes the cataract is at a much later stage than what is typically done in people, right? So it's like a hypermature or late immature cataract or white cataract, and much thicker and sometimes even fibrotic. But something you mentioned, Ivo, that is makes a lot of sense to me too, and that we try to hit on that button often is visualization, even in the beginning of the surgery, to be able to see the whole eye. And animals, we deal with a third eyelid as well that gets in the way. So not securing the eye in the perfect position centrally and operating the eye that's dancing around is the best way to get into trouble. And I'm a big fan of absolute visualization. I place stacking sutures so that I can maneuver the eye and place it wherever I need it to be. Sometimes our patients have highly anophthalmic globes, very large, deep sunken orbit, and then the eye needs to be put into position for a proper surgery. And the way to do that is by placing stacking sutures, often at 12 and 6 o'clock. The ventral one, I'm a little bit more ventral medially because of the third eyelid, and then I can bring the eye into perfect position for surgery.
And listen how interesting it is. I hope you guys are paying attention. Beatriz, in less than 5 minutes, she did 3 different cases. She did a clockwise capsulorhexis, then unclockwise, and now suddenly she's doing a white cataract, which is very common for you guys. We know that a lot. And she's doing it also with a lot of components of the lens that they're coming out. So guess what is happening to Beatriz? Now you can see an expert doing that because she has not only experience in surgery, but she has also experience with the simulator, and she's adapting so much. In that scenario that she's doing, she can do high tension capsulorhexis and low tension capsulorhexis. She can do it clockwise. She can do it unclockwise. And guess what? We were talking about mastery today. She can do it with the non-dominant hand even. Imagine how important it is for you to be able to train your non-dominant hand. And again, it's endless, the capacity to learn in a scenario like this. And remember, we are in the first part of the journey. We talked about ergonomics, we talked about hand biomechanics, and now suddenly we started with normal cases, but now we're putting more complexity on it. And we're only talking about capsulorhexis, because if we show you, we can now do that in phaco too. And in phacoemulsification, it's very important not only to learn one technique, but many techniques, to have that repertory of techniques in you so you can adapt to different cases. For example, Oliver there can put cataract surgery in very complex scenarios, okay? In this case, they're doing something I would like for you to know, it's a plaque in the anterior capsule. And we have seen a lot of these cases also in pets and in dogs. Again, with what Henry said, it's like every time we face surgery in many pets, we can see that there is not like a regular eye. Probably it's an eye with a lot of inflammation prior. You can have problems in the cornea, but also you can have synechia from the iris and the lens, or actually from that synechia, you can have those plaques. And guess what? When that vector of the capsulorhexis passes through that, it's going to change big time. Okay, so you're going to see, how you need to behave with that. But again, I will strongly like your comments, Henry, because you probably trained like me, yeah, right? We are used to train in with real patients in the operating room. We didn't get the chance to have this kind of variability to learn how to make decisions or problem solving in an eye. So what do you think this is the way to go?
Absolutely. This is, like you said, it was trial by fire, dealing with plaques and synechia and just learning as we go, and having to have everything in mind at the same time, positioning, hand position, eye position, left hand position, all that. It's a different story training that in a simulated environment first.
Very good. And now, there is so much to show that I don't know where to start. And we can spend here like 4 or 5 hours because that machine is so powerful. But let's go, Oliver. Let's do one chop training. I want them to do some chop training. And in the chop training, what I really want to make a point is what it means to be a cataract surgeon with phacoemulsification. And that means to be synchronized. You need to use your 2 hands, your 2 feet, you need to see correctly, and you need to make the right decisions. In this case, it's so powerful what your guys are going to see. We can put a soft cataract, medium cataract, hard cataract, and you're going to have augmented reality guidance. I'm going to say this again. Augmented reality guiding you step by step what you need to do. For example, in that case, she needs to remove the epinucleus in the beginning, because the epinucleus sometimes is not that hard, and you want to reach the nucleus of the lens to hold it and then do the chop. When she removes the epinucleus, and you see also a bar in the bottom that is telling you, okay, you are almost ready, right? You did 80%, you did 90%, you need to remove a little more. In that case, she needs to remove a little more of the epinucleus. Yes, remove a little more there. You need to remove more of the, maybe in the sides. Do it in the sides.
Ivo, now you hear me?
There you go. There you go. Perfect.
Okay, we lost the sound, but now we are here. Also,
Okay.
As Betty finished, we can see the parameters and what's happening with this case. Okay.
Perfect.
Now,
Perfect.
as you see, the top and to the left, she has the
Yes.
parameters of ultrasound, aspiration, irrigation, and vacuum. Also, I hope you can see the screen.
There you go.
We have all the settings of the phaco machine. We can move the height of the bottle. We can move the vacuum. Maybe I can put a little stress on Betty, moving the vacuum. Also, we have the flow. We can put continuous irrigation on take it out. We can have also sculpt, quadrant removal, A&I, bores, continuous, or pulse mode. So we can change every parameter as we want to improve the experience.
So imagine, guys, you are in a dynamic environment with the phaco machine in your hands. She's doing a very complex task that when you see an expert looks so easy. It looks because you don't understand all the items that are involved in how to do that chop. So again, she's doing what we call the holding with the right eye, with the right hand and the phaco machine in 2-3-2. She needs vacuum, ultrasound, then high vacuum again. Then she needs to use the non-dominant hand in order to create a vector, which is not easy. We can control what, you can control what she's doing with a non-dominant hand. And also, Oliver, I would like when she finishes for you to show the metrics. Okay, because it's very important to understand the objective feedback when you do something. There you go. So now she's chopping. Do you see that? Amazing chopping. You see Beatriz doing that? You think very easy, right? Guess what? It's not. It's not. And you need a lot of training hours to be mastering that. Okay? So now she needs to switch parameters to have high vacuum, high aspiration rate. She's going to remove the fragments. There you go. You see that? Again, guys, I get very excited. I'm not very objective here, but this is a complete revolution. This is a complete revolution in how not only you can learn, but you can improve as a surgeon and go to mastery. You can put so many flying hours. Think about yourself as a pilot. Think about you putting hours, seeing complex scenarios, seeing complications, and there is so much we need to learn for example, the airplane industry. So she finished it now, and now let's do that. So, metric. Look how powerful it is. When you finish, you say, "Okay, this is the way it is." Yeah, try to show the one thing.
So what we are looking here is the parameters we can see to improve. So if we don't have feedback, we can't improve. What we are looking here is, okay, it says target achievement. She finished the task. She has 100%. But what happened then? At time, the simulator takes 3 points out because she maybe spent too much time doing this task. But also we have a lot of parameters that the machine is measured all the time. So maybe she can break the posterior capsule. She can do a lot of ultrasound. Here it says he go with the chopper too deep. So maybe she can have some damage of that sonula or that capsule. And also the chop line not cut completely. So we have a lot of parameters we can improve. And if we can have this kind of feedback, she can improve doing that task. Now we are going to change the kind of cataract. We're going to put a hard cataract with small rexes and look the difference.
It's amazing. Again, guys, think about it. This is called, in simulation, contextual interference, which means that I'm going to change the scenario in order for you to learn how to think. Let me say it again, to learn how to think, to learn how to make decisions, to learn how to solve problems. This is the cognitive aspect of what I like about surgery. And guess what? We're going to start to talk this to the next level that are called the mindset skills. Because you know what happens when you are doing a technique that looks easy but has high risk? Stress comes to the place. And many people answered that in the question, right? Stress, there is so many mindset components here, and chop is exactly this. It's easy for Henry that has a lot of experience to chop and he makes it look easy. But then when you need to do it, maybe not that easy, you know?
I have asked Betty purposely to have some damage to that capsule.
Yeah, do some damage to the eye. That's what we want. We want some mistakes. Let's do some mistakes.
We want some blood in this webinar, so
exactly.
Okay. So now she has some complications. She has a posterior capsule rupture, as you see. But also, we can do with the simulator, what we can do with the simulator is to have complications. We can also have some anterior vitrectomy exercise, as we're going to.
Yes. Exactly.
So-
Let's go to the. So what
We
we
have-
want now, guys, is we want to we're trying to make this less than an hour. We're gonna get so excited with this. We can be here 2-3 hours. So we're gonna
Right.
repeat this to everybody. We want to thank you for being here. We're gonna repeat this many times as possible. In Fake Mentors, you're gonna see so many videos and so many resources, either Instagram or YouTube. We're gonna keep trying to make a community with you, to put a lot of knowledge, a lot of videos, and listen to this. What I said in the beginning, competency, what it means to resolve complications. Everybody should be ready to do an anterior vitrectomy. There is also many intraoperative devices that we can show. We have stuff to dilate the pupil. We have capsular tension rings. We're gonna leave that for volume 2 because we are getting so excited with this. And now by finishing in anterior vitrectomy, we're gonna still give you guys some cornea videos.
Right.
Okay.
Right.
But
We're going to start-
before that, yeah, let me just quickly say the importance about anterior vitrectomy and how Oliver can guide you step by step in how Beatrice is doing something that it's very difficult to do, but every single one of you can master this through simulation and to having the correct phaco machines. Sorry, Oliver, keep going.
No, right. We are going to talk in a few minutes about some cornea things we can practice in this simulated environment. And now Betty is practicing something is kind of impossible or kind of difficult to practice if you are not in a simulated environment. Why? Because you're not going to purposely break a posterior capsule to solve it. And when you have this problem, you are worried, you don't know how to do it. What we teach every week at Ophthalmo University is that every step has principles and also anterior vitrectomy. What Betty is doing now, as she is a master in anterior vitrectomy, is doing anterior vitrectomy solution, but she's respecting every principle of this task. One of them is to always have the anterior chamber filled with solution or with visco in order not to collapse. So as she finished the anterior vitrectomy, sorry, she's going to put some visco. Always she's maintaining the irrigation cannula inside the eye in order not to decompress. And now she can go out with a correct anterior vitrectomy exercise done. So we're going to change a little in the.
This is great, Ivo. This is great because shallowing of the eye at that time will enlarge the rupture. And this is something that the physics of this, to me, it makes no difference if it's in a human eye, canine eye, pig eye, bird eye, anything like the physics will be the same. If you have a ruptured posterior capsule and that chamber shallows, that rupture will increase in size. It may bring vitreous with it. So it's very important to this practice to me to keep the eye inflated while you address a capsule rupture. And simulation is great for that too. It's a difficult step if you're not used to it, or especially if you're not using the surgery, if you're not doing 2 incisions in your surgeries.
So now we have some slides to talk about some cornea things that can be done in humans and also in some pets. This presentation was made with the collaboration of Francisco Javier, that is a student and a friend of us. He's a Mexican veterinarian, an ophthalmology Mexican veterinarian. So this is the presentation. He's Francisco Javier Benavides. And what we're going to talk about is that there is very common pathology in cornea talking about the dogs and also other animals. And the purpose talking about pets or animals is to preserve the quality of light that comes inside the eye. As you see, the corneal perforations are very, very common. Very, very common. And
Yes, so we're not seeing you, Oliver, in one of the screens. There you go. We're seeing Beatriz. Now, if we can see the slides. Now we can see the slides. Let's see if we can see you guys.
okay. Now, can you see us?
Yes, perfect.
There's, okay. So what we're talking about is some corneal perforations. That is a very common pathology, talking about some dogs. Okay. Now, we can have a lot of techniques. Now, this is a amniotic membrane that we can use to repair these kind of things. How the progress on these patients. This is a patient, these are patients of the Dr. Francisco. How we have a lot of techniques. Maybe we can have amniotic membrane, we have conjunctival graft pedicles. Also, we can have corneoscleral or corneoconjunctival transposition, as you see in these examples. And these are techniques that are not easy to practice at the beginning. When you have your first cases of this kind of patients, it's not easy to have the graft, to put sutures in the cornea. So these kind of things you can practice here at the campus. This is a penetrating keratoplasty that we can talk about. Maybe we can have an hour talking about these kind of things. And this is the picture of our friend Paco, that is a student that comes here to the campus. Now, as you see, we can practice a lot of exercise, small pupil patients, hard cataract exercise, anterior chamber navigation, white cataracts, hard rhexis. And also, if we can, how much we can learn. It depends. If you are doing theory, you will learn so little. But if you have mistakes, you have feedback, you have a mentor, you can improve your practice a lot. Okay, so start the video. So here at the campus, we can practice mainly with two things or three things: pig eyes, bionic eyes, and also the simulator. This is a practice that we do almost every day. That is the sutures. How can we practice with a pig eye, with a 3D screen, with a perfect model to fix that eye, and also talking about how to hold a graft, to put a graft, to do a keratoplasty of that eye, and also the principles of microsurgery. As you see, and as you also do, at first, it's not easy to use a 10-0 suture, so you can improve doing with maybe a 7-0 suture, then doing an improvement, okay? So this is one way that we can learn here at the campus. Another way is also with 3D printed eyes. As you see, this is a bionic eye, where also you can do some grafts to control the cornea problems. And these are some of the students, veterinary students, that has come to the campus. They are from all, most of them are from Mexico, but we have already some students from other parts of the America. And also, we have recently a student that has done his first cataract surgery. He has his own microscope. He has a microrec. We was teaching him from the campus, and he was in Chihuahua. It's a state from Mexico that is near to USA. And he do a complete cataract patient after he comes here to the campus and do simulation. So thanks for sharing. We can do some other exercise with the simulator as you wish. I don't know, Ivo, what you want to continue.
No, I mean, again, Oliver, thank you so much for sharing that. You know, again, we wanted to be 1 hour, and we will have 4 minutes to get 1 hour. This is how serious we are in what we want to do. We want to basically share knowledge in the most efficient possible way, in the least amount of time as possible. Henry is somebody who I can tell you for a fact that it's moved by purpose. And purpose, in this case, we share. And our purpose is, besides many, many other things that can come into account when we're trying to train people, is to spread knowledge, is to make those dreams that we had when I was 32 with no resources and wanted to become a cataract. It took me 2 years, 7,000 kilometers from my country. Well, now we can change that. We can change that through simulation. We can change that through active learning. But most of all, we can change that being part of something bigger than us. And that's community. And that's what we want here. And we want to build a community with you guys. We are so happy. Right now, I'm in Brazil in a meeting with many, many speakers, also building community. Our most important objective will be to do a meeting between us. Why not? We have more than almost 2,200 people today. Imagine what we can do together if we join forces. We can get together in meetings. Henry has an amazing meeting with so many great people. And this is the best part. Ask Oliver and Beatriz. They wouldn't let me die. The best part of our work is to meet people from all over the place that we share so much knowledge and passion of what we do. So, Henry, I don't have any words to thank you for making this happen. Oliver and Beatriz are giving us their time late at night to send us a simulation. Rodrigo is there behind the scenes. I want for you guys to see Rodrigo too and his amazing work. Rodrigo, show yourself. Come to the camera. Now, another guy who's making everything happen. Okay, the campus. We're a big family, and we want to be part of you. We're so happy, like so many friends here, Henry. We just want to have a date for volume 2. What do you say?
Absolutely. I'm all up for it. Speaking of late night, you know, Ivo is in Brazil, like he said, so it's 10 o'clock to him now. Thank you so much, Ivo, for donating your time and expertise. And guys, seriously, like they didn't show barely anything. There's a lot that can be done. It's just so much, right, Ivo? There's just so many practices, so many surgeries, so many techniques, and there's a lot to be learned with simulation. We're not even talking some things like retinal surgery, you know, but just fake or just cataract surgery, being well versed in different techniques. And to me, it's important if the resident finishes the residency knowing a minimum more than one technique. You know, like MDs are required to know multiple by the first year. Like we should at least know more than one by the end of the residency. And you know, simulation can help with all that, so the person's not on their own afterwards. And corneal surgery, vitrectomy, so many things that we could cover, intraocular devices. So yeah, absolutely. Let's do it again. Thanks, guys. Thanks everybody in the campus. Appreciate it a lot.
No,
Thank you, Henry. Thank you, Ivo.
No, thank you guys for your time. And let me share with you. I have at least more than 30 comments from people from all over the place. Obrigado, thank you, gracias, from many parts of the world. I'm very excited here. I'm very moved. You know, from the names, I see people also from Asia. This is crazy. What you did, Henry, here is crazy. I hope you guys feel part of a community. We're very excited, and we're going to repeat this 100%, okay?
Absolutely. Thanks again, guys. Thanks, everybody.
Thanks. Hello,
Thank you, guys.
Eugenia, Costa Rica.